Last but not least, my pleasure to present Dr. Hashim بالبيد. He's a consultant geriatric medicine at King Saud bin Abdulaziz University for Health Science in King Abdulaziz Medical City. He will be giving us the last talk prior to the question and answer on break. It's about Alzheimer's disease and continuity of healthcare. تفضل دكتور.
Assalamu alaikum wa rahmatullah. Thank you, Dr. Mana. I'm so happy to be here today with you. Thank you for staying with us. I'll try my best just in my presentation to go to the point. And it's so easy for expert people to diagnose Alzheimer's disease. However, the challenge here is how to handle the case and follow up. Wallah, Dr. Agil. Okay. بسم الله نبدأ. طبعا disclosure, no conflict of interest. إيش رأيكم في الصورة هاي؟ طيب. Alzheimer patient needs a comprehensive assessment, multidisciplinary approach, and developing a treatment plan. We diagnose the patient, we prescribe for him the medication, and some of the specialized physicians in the field of geriatric or neurology or psychiatry or general practice, they will do so and they will forget about very important points in the care of Alzheimer patient. Probably they are busy, they have plenty of patients, other commitment. But definitely we need to go over it in the plan of care of patient with Alzheimer patient. Patient, as we said, that we needs a comprehensive geriatric assessment, and look to the word comprehensive. شمولية. So assessment should address the comorbid medical condition, the functional status, cognitive status, behavioral symptoms, patient support system, decision-making capacity, and primary care giver. طبعا functional assessment, it's very important, and we have very strong evidence that the more we improve the function of the patient, the more quality of life, cognitive, and physical fitness as well. That will include, of course, knowing the process of feeding, bathing, dressing, mobility, toileting, continence, and the ability of managing finance and medication. And by the way, if you have no time to assess, make sure, just ask your patient about finance. يا عم أحد كتبت وكالة ولا شيء، لا تعرف إنه he's good. إذا ما رد عليك وما هو داري تعرف he has a problem. لأن الفلوس عارف if you understand what I mean. هذا بس quick كده if you don't have time to check more history. طيب. Cognitive assessment يا إخواني, as you know that it's very important to have the experience in diagnosing and treating patients with Alzheimer's disease. So you have to have a good clinical assessment before diagnosis your patient with dementia. So you have to conduct and document an assessment and monitor changes in the cognitive status using a reliable and valid instrument. Comorbid medical condition. يا جماعة الخير, those colleagues who's dealing with patient with Alzheimer patient, good percentage of your patient, up to 30%, and other studies up to 40%, they have other chronic medical condition that you need to look after. Heart failure, cardiovascular disease in general, diabetes, hypertension, lung disease. So we have to diagnose the comorbid medical and treat them promptly and efficiently, in particular in the early stages of diagnosing Alzheimer's disease. Thyroid disease, heart failure, pneumonia, MI, they can present totally differently than the typical presentation. They might present like acute confusion, delirium, or functional decline. So we have to be very careful when we assess elderly patient with Alzheimer. طبعا we continue the comprehensive assessment with the behavioral symptoms. It's على فكرة. In the beginning, as you know, when you diagnose a patient with the symptoms presentation with Alzheimer disease, طبعا غير إنه البيشنت family will be really in shock, upset, and their loved one start to lose his mind شيئا فشيئا نسأل الله السلامة. However, in the follow-up, يعني they believe خلاص this is a fact, this is a disease, but تيجي behavioral symptoms, and they will tell you, doctor, please help us. Just we need to help him. لأن behavioral symptoms really in some of the cases it's really significant and bothering some, like anxiety, agitation, apathy in up to 80% of cases. Psychotic symptoms like delusions of theft predominating up to 40%, hallucination, depression up to 50%. Medication وما أدراك ما الميديكيشن and polypharmacy. طيب يا أخواني it's really يعني صعبة شوية when you see a patient moderate to severe Alzheimer disease على tube feeding وعنده pressure ulcer, and when you look at his medication you find out that he's taking 12 to 14 medications. I still remember this sentence from a son of a patient. يا دكتور لو الأدوية هذه فيها خير أبوي ما وصل للمرحلة هذه. يعني هو بيتكلم لك على البوليفارماسي يقول طيب, and he's right. So the system of auto refill medication when a son or relative coming to your clinic just for refill, please ask question, check your patient, check his labs before you renew the medication. Okay? So it is very important to review medication and try to minimize them as much as possible, if possible. So the primary care physician has to know who's monitoring medication usage, who has access to this medication, and who makes the decision for PRN. Is it the patient himself or the caregiver? يعني بعض البي ار ان مثلا زي الانتي سايكوتيك زي البين ميديكيشن, who's making that decision? طيب, as a primary also care physician, you have to answer the following questions. Is this medication achieving the intended effect? Is this medication causing an adverse effect that is annoying or severe enough to warrant discontinuation? Is this medication interacting with other medication in a dangerous way? Is this medication still necessary? And can the dose of this medication be decreased? And can use of this medication be safely discontinued? And by the way, when you discontinue medication, you have to have a good experience. With time, you have to learn. And some medication, really, you cannot just discontinue it abruptly like that. You have to do it gradually. But trust me, with time, you will build up your experience, and for the time being, if you don't have that experience or you're worried about some medication, refer the patient to the specialist to help you with making a decision of discontinuing the medication or changing the doses or so on. طيب, طبعا نيجي important points هنا يا إخواني. على فكرة احنا دائما نتكلم multidisciplinary approach, which is true. Physician, nurses, dietitian, physiotherapy, occupational therapy. The role, for example, here, role of occupational therapy is very important here. Living and the social worker as well. Living arrangement and safety and care needs. Assessment of patient living environment may help identify retained abilities and things the individual is able to do within a familiar setting. It can identify environmental support needed to maximize function and ensure safety and minimize caregiver stress. Important safety issue for risk, medication management, environmental hazards, wandering, driving. وربنا يعين الأسر اللي عندهم الزهايمر patient و they insist to drive. والوقت ما يسمحنا ولا حقول لكم قصص بس أعانهم الله. Abuse and neglect. يا أخواني, we have to be very careful when we assess a patient with Alzheimer's disease coming to you or you go to see him. So look for signs of depression, social isolation and withdrawal, physical signs of dehydration, bruises, broken bones, or poor basic and oral hygiene. طيب أنا شفت هذه في الحالة وش أسوي؟ يا أخي it's a multidisciplinary team. Call social worker, patient relation, just give them a referral or keep the patient name and the number, and they will do their part as well. طبعا تكلم الدكتور نبيل يعني بصورة موضحة وجزاه الله خير عن end of life care in patient with Alzheimer's disease in advanced stage of the disease. So some factors that indicating a poor outcome like dependence in activities of daily living, weight loss, recurrent infection, multiple pressure ulcer, a chronic condition with complication like cardiovascular disease or end-stage heart failure, complicated diabetes mellitus, and needs for home oxygen. caregiver assessment ما يعني اتكلم فيها كثير بس عندي كان ملاحظة لو كان في question answer كنت حسألك يا دكتور. Now كلنا نشوف caregiver coming with the patient and really I'm so impressed about what being يعني mentioned here. However أعتقد إننا we don't give الcaregiver حقه من assessment صراحة. هذا تقصير مننا فعلا and we have to be very careful. And by the way caregiver ما هو لازم يا إخواني الفيزيشن هو اللي يتكلم معه. يعني أنت physical therapist when you see the patient مع caregiver وأنت هذا just talking to him, counseling, appreciating, thank you, جزاك الله خير, dietitian, social worker, nurses, that will help a lot really. So we have to consider really the appreciation. And على فكرة caregiver مو لازم ترى يكون يعني اللي تتكلم معه بس الولد ولا البنت. العاملة appreciate them, شكرا جزاكم الله خير. It helps a lot. دكتور I'm about to finish يعني. I'm good. طيب. آخر few slides عندي هنا developing a treatment plan. So when you see a patient with Alzheimer's disease, خلاص diagnosed, it's not a matter of writing medication, but you have to set a treatment plan for him. Effective treatment requires development and implementation of a plan defined with defined goals for the patient, and goals should be developed in consultation with the patient if capable and with the family. يعني لما نشوف المريض في early stage of the disease أول شيء قلنا تشخيص، الزيارة الثانية الثالثة نبدأ نتكلم في بعض المواضيع المهمة. تمام؟ ما ننتظر إنه المريض يوصل لنا advanced stage of the disease. And by the way, it's not an easy job. It is difficult, and it depends on the type of patient and the family that you are really dealing with. إذا لقيتهم من النوع they will accept some sort of discussion like goals of care, CPR, nutrition in the future, hospitalization and investigation, living well, يبغى يحط وصي. It depends. هذا حتيجي مع الخبرة حقك when you are talking with the patient and the family. However, these are very important points need to be addressed and discussed with the patient if possible, or the family or the caregiver. I mean. طبعا individualize your approach to their needs, values and preferences طبعا, and we have to respect their wishes. Your plan should be modified as the disease progresses. consider non-pharmacological approach, use of cholinesterase inhibitors and NMDA antagonist, and دائما يجيني هذا السؤال, when to stop them? And for how long we continue giving this medication, knowing that this medication having modest effect, يعني ما هو الدواء السحري اللي هذا, لكن اللي موجود. طيب, السؤال, for how long we continue giving that and when to stop it? Hopefully I can discuss with you in the next slide. Treat behavioral symptoms, oral feeding versus tube feeding. تفضلوا الزملاء قبل يتكلموا فيه, and provide appropriate end-of-life care if needed. طبعا referral to adult day services if available, referral to social services agencies or support organization, provide appropriate treatment for comorbid medical condition. When to stop cognitive enhancer therapy? Okay. Most of the study اللي اتعملت في approval of this medication بالذات الcholinesterase inhibitors والNMDA كانت تتكلم على أشهر to 1 year. Okay. Now أنا مثلا عندي مرضى فوق ال5 سنين هم بياخذوا الأدوية هذه, وفي عندي مريض فوق 8 سنين وهو بياخذها. Okay. So someone can argue with me why you are keeping this يعني keeping the patient on this medication. حقول لك ليش. Oh, sorry. كيف أرجع؟ Yeah. Okay. مثلا هذه randomized placebo-controlled discontinuation of study of cholinesterase inhibitors in a long-term setting with moderate to severe Alzheimer's disease. شافوا تقريبا أقل من 150 مريض في هذه الدراسة. As I said, most studies followed patient for months or 1 year. As far as the patient condition is stable or slowly progressing, you can continue the treatment. لأنه الaim of the treatment وكل الانترvention غير المedication and to keep the patient independent as much as possible in the community, serving himself and slowly progressing of the disease, so he will be more functioning in the community as much as possible, helping himself, eating, feeding, sleeping, less behavioral symptoms. وهذا اللي نبغاه للمريض. And hopefully we don't want the patient to reach to the advanced stage of the disease where he is more and more dependent in the activities of the daily living. So as the disease progresses, more cognitive decline and more dependence on ADLS, think of discontinuation. However, when you think of discontinuation, be aware that sometimes abrupt discontinuation of this medication might cause worsening of the cognition. So take it gradually and slowly. Nutrition and advanced Alzheimer's disease, يعني ما حتطرق غير نفس السلايدز اللي بيناها الزملاء قبلي. وهنا كان نفسي أسأل سؤال زميلتنا الدايتيشن إنه طيب في الادفانس ستيج اوف ذا ديزيز، طبعا احنا عندنا الايفيدنس هنا يقول لك انه الادفانس ستيج individuals reach the advanced stage no longer able to eat, it is ethically يعني هذا next slide يقول لك research on tube feeding that shows it does not usually improve nutritional status nor does it prevent or lower the incidence of aspiration pneumonia. بنتكلم عن tube feeding. طيب فإذا كان المريض is capable of taking orally عادة اتبع نظام لقيمات يقمن صلبه ما أمكن. طيب ودائما أنا أسأل زميلاتنا وزملائنا الدايتيشن يعني كم كالوريز، بعضهم يقولوا لي لو قدر ياخذ 700 800 كالوريز في الادفانس ستيج he's fine. كله عشان to avoid tube feeding في الادفانس stage of Alzheimer's disease. In summary, patient in the early stage of the disease involved in the care plan, referral to community resources, discuss issues related to work, driving, and other safety issues with the patient, initiate pharmacological therapy early, recommend intervention to maintain functioning and independence. وركزوا لي على هذه النقطة functioning and independence. هذا اللي what we are looking for in our patient in geriatric in general and Alzheimer's disease in particular. At the advanced stage of the disease, as the disease progresses, care shift to focus on the relief of the discomfort. We have to think about if hospitalization, screening tests, artificial nutrition, and hydration will depend upon the plan of care discussed with the patient and the family earlier. Referral to hospice, if available, should be considered. These are valuable resources about Alzheimer's disease in general, and with this, I'm done. Thank you very much.